Great! Here's a set of 10 clinical vignettes in Puerto Rico Medical Board style to help you diagnose different types of anemia, each with a detailed explanation. 1. Vignette: Iron Deficiency Anemia. A 35-year-old woman complains of fatigue and heavy menstrual bleeding. Labs show HB 9.gram theta, MCV 70 fefira, ferritin 8 nangram MBC. Diagnosis: Iron Deficiency Anemia. Explanation: Microcytic anemia plus low ferritin plus high TIBC are classic for iron deficiency, often due to blood loss in menstruating women. 2. A 25-year-old Mediterranean man presents with mild fatigue. CBC shows HB 11 gas per liu, MCV 65 F fetals, ferritin normal, RDW normal, target cells on peripheral smear. Diagnosis: beta thalassemia minor. Explanation: microcytic anemia but normal iron stores. Target cells and ethnicity are key clues. Vignette: anemia of chronic disease. A 50-year-old male with rheumatoid arthritis complains of fatigue. Labs: H-pen 0.5 gram butter, MCV 82 F etter, ferritin high, TIBC low. Diagnosis: anemia of chronic disease. Explanation: normocytic or microcytic anemia with high ferritin and low TIBC in chronic inflammatory conditions. For vignette: sideroblastic anemia, a 67-year-old alcoholic with weakness. Labs: MCV 65 fefilo, basophilic stippling, bone marrow, ringed sideroblasts. Diagnosis: sideroblastic anemia. Explanation: iron trapped in mitochondria due to defective heme synthesis, associated with alcohol, lead poisoning, B6 deficiency. 5. Vignette: B12 deficiency. A 70-year-old woman with neuropathy, glossitis, and fatigue. Labs: MCV 112 FL, B12, homocysteine and methylmalonic acid. Diagnosis: vitamin B12 deficiency. Explanation: macrocytic anemia with neurologic symptoms, elevated MMA. Folate deficiency. A 40-year-old alcoholic presents with fatigue. Labs: MCV 110 FL, folate, homocysteine, normal methylmalonic acid. Folate deficiency. Macrocytic anemia without neurologic symptoms. MMA is normal, unlike B12. Vignette: hemolytic anemia, G6PD deficiency. A 22-year-old man presents with jaundice after taking sulfa antibiotics. Labs: LDH, haptoglobin, reticulocyte count, blood smear Heinz bodies, bite cells. G6PD deficiency. Explanation: X-linked disorder. Oxidative stress causes hemolysis. Vignette: aplastic anemia. A 30-year-old woman with fatigue, easy bruising, and infections. CBC: pancytopenia, bone marrow biopsy, hypocellular marrow. Diagnosis: aplastic anemia. Explanation: bone marrow failure due to radiation, virus, or autoimmune. Vignette: sickle cell disease. A 15-year-old African-American male with recurrent pain crises. Labs: normocytic anemia, reticulocytes, sickle cells on smear, HB electrophoresis, HBS, diagnosis: sickle cell disease. Explanation: vaso-occlusive crises and hemolytic anemia in HBSS patients. Vignette: lead poisoning. A 6-year-old child presents with irritability and developmental delay. Lives in an old house. Labs: microcytic anemia, basophilic stippling, free erythrocyte protoporphyrin. Diagnosis: lead poisoning. Explanation: impaired heme synthesis, classic in children exposed to lead paint. Would you like flash